we can cancel those, other two.
Sure. Okay. Either way, whatever works. Yeah.
Hi, Sammy.
Hey, hi, Natasha.
Hi, Data.
Yeah.
Again.
I just want to make sure I have the ability to share my screen here, which I should. All right. Can you see that okay, Natasha?
Yes, I can see
Okay,
that.
perfect. All right, just wanted to make sure everything was working.
Well, since we're recorded it, you can go ahead and start if you want.
Okay.
So that way there's not so much time in the beginning.
Sure. Sounds good. Hey, everybody. My name is Andy Fullerton. I am the health insurance broker, employee benefits consultant for Community Anchor Services. Just a little background about myself. Prior to being in the insurance business, I worked 20 years in supported living. So what you all are doing is my passion. I'm on a board for a nonprofit SLS company in the Woodland area, so just outside of Sacramento. So I know what you guys do. I love what you guys do, and thank you for helping out those that need our services. Just gonna kind of go over what plans we have to offer for medical, dental, vision, and then everybody gets $25,000 in life insurance as well that the company pays for. Nope, I got a little feedback there. Sorry. So I'm gonna share my screen and kind of go over ease. So ease is our employment portal where you go on and you for open enrollments, or if you're a new hire, you might have gone on and completed your enrollment via ease. So what I like to do every year is kind of go over ease, show you kind of step by step, so that you won't have any issues. And if you do have issues, you can always reach out to myself or my team, and we can always assist you with that. So let me share my screen and I'll kind of go over everything, and it'll kind of show the plans as well in there. But the 4 plans that we currently have for the medical are, we have 3 Kaiser plans and 1 Sutter Health Plus plan. So if you're with Kaiser, you'd have to go to a Kaiser doctor. And if you're with Sutter Health Plus, then you would go to either Mercy or Dignity Health as your area network. Does anybody have any questions before I get going just on that? Yep. Hey, Timothy, how you doing?
Can you hear me?
Yep, I can hear you.
Oh, yeah. So I was wondering, do you mind if we record this just in case? I mean, we want to show this to some people who weren't able to make it.
Yep. Yeah. I actually, let's watch. did I say, is it Latuasha or is it Latasha?
It's just Latasha. It just has a
Latasha,
silent
okay.
U
I
there.
see that the U there and it threw me off a little. Okay, so yeah, Latasha's already got it recorded. So
Oh,
we're,
okay. Okay.
yep, yep. Thanks. All right, so yeah, so you have the 4 medical
What did
plan.
we,
Oh, go ahead.
so,
Datsun, you have a question? I think we're good.
Okay, all right. And then we also have a dental plan and a vision plan through Beam Dental. Both of those will be voluntary. And what that means is if you're wanting to sign up with the dental or the vision, it's going to be 100% on the employee to pay for that through payroll deduction. So anytime you have payroll, that it would come out of your payroll for both the dental and the vision. And then for your medical, the company Community Anchor Services has contributes 75% to the base plan, as we call it, which is kind of the lower plan. And then if you want to buy up to a better plan, you can always buy up and just pay the difference. But they will pay 75% to the Kaiser Bronze HMO plan. So, and I'll kind of go over that here when I go into ease too. I just wanted to kind of give you a little bit of information on that. All right, let me share my screen and then we'll go from there. Okay, can you guys see that? Okay. Perfect. Okay, let me, oops. So when you will, everybody will be getting an email. You might have already got the email sent to your email, but if you do not, you can always reach out to myself or Latasha and she can let me know if somebody didn't get the email. But you'll get an email and it'll say welcome to ease, and then you'll click on the little button and then it will take you to this page here. And it will say ease Community Anchor Services. It'll have your email in here for that, and then it will ask you to make a to make a password if you haven't already made a password. And once you put that in, that will be your password. You can access this at any time during the year, just in case you forget what plan you're on, or if you're about to go see the doctor and you want to know, all right, what are my out-of-pocket costs going to be associated with my doctor's appointment? You can go in here and check that out at any time. It won't let you make changes to your plan because the changes only happen once every year during open enrollment, which is the month of July for us. And then the new plans will go into effect August 1st of 2024, and then so on 2025. The only way, so what I like to tell everybody is this is your opportunity to get onto the insurance. If you decide I already have insurance through a spouse, or I don't want insurance at this time, just know that you're going to have to wait an entire year to then get on the plan. So in 2 months from now, if you decide, oh, I want to get on the plan, unless you have a qualifying event, you would not be able to get onto the plan until next year at this time. Qualifying event is anything from a marriage or divorce, or if you move out of the area and Kaiser is no longer in your area and you need to go to Sutter or somebody else, some other carrier, that's a qualifying life event. If you have a baby, that's also a qualifying life event, and then you can change your plan to either bring that person on, or you can even change plans if you're bringing on a dependent and maybe you can't afford the plan that you're on currently. You can always downgrade to a different plan as well. So I'd just like to let everybody know that, because sometimes people will say, oh, I decided I want it 2 months later, and the carriers will not accept it unless you have a qualifying event. Does anybody have any questions on that before I dive in here to ease? All right. All right. So once you put in your login here, it will bring you to this page, which it says start open enrollment. And then you'll click on the start enrollment. It'll kind of tell you, hey, it'll take about 15 to 25 minutes to complete this. Once you do it for the first time, all your personal information is going to be saved in this ease for next year. So if it took you 20 minutes this time, next year you won't have to fill it. You'll be able to bypass through some of that. And so it might be a little bit, maybe 10 minutes, depending on how much information that you need to change. So you're going to go ahead and start and click on start to start it. And then you'll get this overview page, which will tell you exactly what benefits are being offered. So the cost here, it tells you about the cost. They're covering 75% of the California Choice Kaiser Bronze HMOA plan for employees. And if you want to add dependents, the dependent costs are going to be 100% on the employee. And these are the 4 medical plans that I kind of went over earlier. And then the dental and vision, we're offering dental and vision, 1 dental plan and 1 vision plan through Beam Dental. And those are voluntary plans, meaning, like I said before, you will pay the entire cost of those if you choose to enroll in them. And then the life, AD&D is your $25,000 of life. And that is paid for by the employer, by Community Anchor Services. So make sure that you sign up for that, because that's a free benefit for you. Everybody likes free benefits. All right, and then it tells you about the enrollment, and without a qualifying event, kind of everything that I just went over, you're going to have to wait until next year to do that. Here are the qualifying life events as well. I went over most of them, but there's a little bit more in detail. And then once you get there and you've read all that, you're going to press continue, and then it's going to ask you for your personal information. So your name is necessary, your sex, so your male, female, marital status, disabled, whether you're disabled or not, that doesn't matter. I don't know why that still populates, because in medical insurance now, nobody can be withheld from medical insurance due to pre-existing conditions. That was taken away by the Affordable Care Act back in 2013. And then putting in your birth date there as well. And then it's going to ask you for your address and all the personal information. Now, let's say you complete everything, but you forget to put in your zip, and you go down here and you click continue. It will show you in red, oh, wait, this is required in order to continue. So it won't let you continue until you have the required fields in there. Let's see, oh, sorry. 95695. Okay. So once you've completed that, you're going to click on continue. And then it's going to ask you for any dependents. If you have a dependent that you want to add, you'll just click on add. You'll put in the dependent's information, name, sex, birth date, social security number is also required, and then relationship. So if it's a relationship, whether it's a spouse, your ex-spouse, most people don't have ex-spouse unless the court says that you need to pay for your spouse through a divorce settlement, and then your child, if you have as many children. Disabled, you can put that or not, but it's not necessary either way. And then you click on add dependent if you had any dependents. So I'm going to just say for now that I don't have any dependents, so I'm going to click on continue. And then if you look over here on the left, this is kind of the order that we're going in, but please make sure you just stay on this and click continue, because somebody can you could click dental and then you might accidentally totally forget about the medical, or if you do it that way. So it will take you through the progression, so you don't have to do that on your own. And then when you get to this page, it will have your name here. And if you select the check that you want to enroll, or you can waive. And if you decide, okay, I don't want medical insurance, I have it already, or what the reason is, you will go here and then you'll just put the reason that you are waiving. So, I mean, it could be other coverage, it can be spouse's plan, parents' plan. Just find the one that is most accurate to your situation. So then you're gonna click on the enroll, and then down here, it's gonna show you the different plans that you have to look at. So the Kaiser Bronze plan is one of the plans. You have a Kaiser Gold, Kaiser Silver. So in tiers, Kaiser Bronze is the lowest tier. So that will be the cheapest plan. Silver will be the next, and then gold will be the most expensive of the ones that we have. And then you'll have a Sutter Bronze HMO plan here as well. So if you're wanting to know how, okay, what cost is it going to be for me? The Kaiser Bronze HMO plan, if this is the plan that I want, I'm going to select this plan over here. And once I select this plan that I want, it's going to show up here on the right side, medical. It's going to be $297.93 for your portion. So that would be, remember, 75% is paid for by community anchor services. So the other 25% would be, will show up here on the right side. Another thing I like to tell people is they're like, okay, well, I don't know this Kaiser Bronze plan. I'm not sure what that plan has. So if you click on one of these, a summary of benefits and coverage, if you click on there, it has this for each plan, it will tell you exactly what is going to be your deductible, the different out-of-pocket costs, what your max out-of-pocket cost is, which is $9,100 on this plan. That is your catastrophic. If you were in the hospital with a serious injury, you run up a $2 million bill. The most that you will ever pay in a given year outside of your insurance is $9,100. Once you reach that $9,100 for the year, if you had a long hospital stay, that would be all you pay, and then insurance would kick in 100% after that. So that's what out-of-pocket limit means. And I always like to let people know what that is. And then it will tell you over here, it'll tell you your primary care visits, how much is going to be your primary care visit. On a bronze plan, it's going to be $65. If you have to go see a specialist, it's going to be a $95 copay. And then they have x-rays and the generic drugs as well. So it kind of will list that. If I get out of this real quick, so let me jump out of that. If I come down here and you want to see the gold plan, for instance, it will still have the same thing, but you're only going to have a $250 deductible on that, and then a $7,800 out-of-pocket limit. So that's the max that you would ever have to pay if you were in the hospital and ran up a very large bill. And then the copay, as you can see, as now we're on a gold plan, which is going to be more expensive monthly for premiums. But when you're out-of-pocket costs, so whenever you go to the doctor for a copay, it's going to be $35 rather than that $60 that we had just talked about, and then $55 for a specialist rather than the $90. Just something that I always like to note as well, preventative care screening. If you go see the doctor once a year, and it's a preventative care screening, so you just want to go get a checkup by your doctor, that you will not be charged at all for that one time. But what I always like to tell people is make sure when you're saying what the doctor appointment is for, that you say that for my annual checkup. Don't say, oh, because I have an ear infection or something like that. They won't consider that a preventative care because you are complaining of something happening. So you will get charged the copay. So whenever you're doing that one preventative care per year, make sure when you're setting it up with the doctor that you let the doctor know that it is that your annual physical, and in that way you will not get charged for that. Do any questions?
Could you repeat that again? Yeah,
Yes.
Could you repeat that again? Because I just wanted to know if you have an issue coming up and you haven't had your annual checkup, is that what you're talking about?
Yes. So if you haven't seen your doctor in quite a while, I would request your annual physical, and because that way they'll be able to see you. You won't have to pay that copay. And then after that, if you have to get seen to do something, then you still wouldn't have to pay that copay because you're already there at the doctor's office. So that's something to think about if you haven't seen the doctor in a while. Make that appointment for your annual rather than just for purposes of whether you have an earache or some kind of issue that you're having. Does that help, Joshua?
Yeah, that helps a lot. Thank you.
Yeah,
And
sure,
then,
no problem.
The 297.93 that I'm seeing there, for example, is that the 25%?
Yes, that would be the 25% monthly. So yes, that would be the 25% for myself, for my age. So it's going to be different for everybody depending on your age, because everything is health insurance and the group is based off of everybody's age.
Okay, and then that's going to be split into two, for example, if you have like 2 pay periods in a month.
Correct. Yes, correct. Yes.
All right,
Good,
guys.
good
Thank you.
question. Thank you, Joshua. Yes, yeah, that is correct. So any of these you can kind of click on. If you, for instance,
Andy?
yes,
Before you get going, about that specific thing we were just talking about, is the no charge for every plan or just the gold or the bronze?
no, that's for every plan.
Okay.
Any medical plan that you're on, you get 1 free visit a year as your annual visit, preventative, as they call it, a preventative visit. And they do that because they want you to come in so that you can prevent, other things of, and having to keep going to the doctor for other things. Yeah.
Awesome, thanks.
Yeah, no problem. There's other things that you can also look in here. And none of these, you can do a virtual visit if you'd like. There's other stuff that you can do, but the main one that I always like to talk about is the summary of benefits, just so that you can go in and actually see what the plan entails and how much you're going to be paying out of pocket when you go see the doctor. That's the most important part. Okay, so you're going to enroll yourself if you want to, or waive. I have enrolled myself here on the Kaiser Bronze plan. I'm going to go down here to the bottom and click continue. And then you'll see that I'm done with the medical. It's now taking me to the dental. And you're going to do the same thing with the dental. You're either going to enroll or waive, and then the reason for waiving, if you're waiving. We have one plan that we have, and that is the Smart Premium Plus plan. And that will be selected. And that plan, I don't think we have the summary of benefits in here for that, but just to let you know that the beam, you have $1,500, it's at a $1,500 allowance that you have for the whole year. So if you go to the dentist and you get your annual cleaning done, you can do your annual checkup. That's not going to cost you anything except for a $50 deductible that you have to pay once a year at the beginning. So whenever you first get seen at the dentist for that calendar year, starting in January or February or whenever the first time that you go, you're going to have to be subject to the $50 deductible, and that's just the one time. And then any other time that you go see the dentist, you're just going to be paying for what the dentist cost is. You're not going to have an additional $50 deductible to pay for. The 180/50, what that means is if you are preventative, any kind of preventative, you get the 2 cleanings a year. That's all paid at 100%. So your dentist, your insurance, the insurance, they can bill the insurance, and the insurance will pay 100% of that. If you have 80 is for the basic services. So if you have root canals or any tooth, any endodontics or periodontics, if you have to get any kind of gum surgery or anything like that, it pays out, insurance pays 80% of that portion of the bill, and then you would pay 20%. So let's just say you go to the dentist and you have to get, you have a cavity and you have to get a cavity put in, and the cavity costs, let's just say $400 for the work and everything that you got done. 80% of that $400 is going to be paid for by the insurance, and then 20% of that $400 will then be paid by you. Does that make sense to everybody, or does anybody have any questions on that? Okay, and then the major category is the 50%. So if you have to go get a bridge done, or you have onlays or inlays, or if you have dentures or anything like that that you have to get put in, we consider that major. And so whatever that cost is, insurance will pay 50% of that. And then you as the employee are going to pay the other 50% of whatever that bill is. Up to the $1,500. So let's just say you had a $400 bill previously, insurance paid, 320 of it, you paid 80 of it. So 320 has been now used from your 1,500. So then you'll now have, $1,180 left for the year. And so let's say you have to pay 50% of $1,000 bill. That's 50% is going to be paid for by the insurance. So that $500 would go towards that 1,100, and it just keeps working its way down until you've used all of your 1,500 for that year. Once you use, the insurance pays up to 1,500. Anything after that, you're going to be paying at 100% of any other costs that are accrued after that. A lot of dentists will say, okay, you don't have enough to cover this. Do you want to push this off until January? That's why you might hear your dentist say, do you want to do this now, or we can push it off until January, because they know that's when your $1,500 will come back in full, and then you'll be able to use that again. Any questions on the dental? All right. So you're gonna, if you want the dental, you're gonna select the dental and you're gonna click on continue, and then we're gonna go to the vision insurance. Vision insurance is a lot cheaper than everything else. So for instance, for an employee only, it's gonna be $6.47. What your vision, you're gonna have a $10 copay whenever you go see your ophthalmologist, or if you just go see somebody, an assistant or anybody, you're gonna have a $10 copay, and then you get an allowance of $150 every 2 years to get new frames if you have glasses, or new contacts if you have contacts. So every other year you get $150 as a kind of a gift card. So if your frames that if you were like really nice frames and your frames cost $250, $150 will be covered by the insurance, and then you would have to pay the additional $100. So that's totally up to some people, like their frames or their contact lenses, special ones, and if so, then you might be paying a little bit out of pocket for the most part on the vision. All right, and so I will click that yes, I want to go into the vision, and then you will get to the life AD&D plan. The $25,000, it already says you're enrolled, so you will automatically be enrolled in here. It will have you selected. It should already pre-select you, but if it doesn't, just click on the selection, and then you're going to press continue, and then it's going to ask you if you have prior coverage. You don't need to do any of this. The system just does it anyways, but you don't have to add your prior coverage if you don't want to. They don't require that. And then you're going to click on continue again, and then it's going to bring us over here to the summary. So it'll give you a summary of everything you've chose. I chose medical, Kaiser Bronze HMO plan. I am going to do myself for the dental and for the vision, and then the life, as you see, is $0 because it doesn't cost anything to you. And so after that, you're going to click continue, because it just kind of went over your summary for you. And actually, let me just back up real quick. Just as we're going over the benefits too, it will tally everything over here too. So you'll be able to see what your total is going to be monthly. $356.62 would be my monthly amount if I was going to take all of those. So it just, if you want to know how much it's going to be, you can kind of see here even before you get to the summary portion of it. So let me go back to the summary. We already did that. We clicked on continue, and then it's going to ask you to sign forms. Sometimes people are like, oh, okay, I did it, I'm done. If you don't sign the forms, it will tell us on our side that you have not completed it. It won't tell us how far you've completed. It just will say that it's not completed. So please make sure and then go through, you're going to be going through this whole thing. You're going to click on sign forms. And so it will automatically generate the forms, which is very convenient. And then it will say, okay, create your signature. And my signature is Andy, obviously my name. It creates a signature for you. You click next, and then it will ask you to do one with your mouse as well. So you can do it. I just squiggable because it will take like 8 times for me to get it to where I like it sometimes. So you can click next, and then it will say, okay, you're going to review and sign the forms. So you just click on next. It automatically takes you to every form where you need to sign. All you have to do is click on the green, and it automatically puts your signature in there. And then when it's done, you'll see up here on the right, finish signing. You're going to click on finish signing. And then it will say, congratulations, your enrollment elections have been submitted for your review. How was your enrollment experience? You don't have to submit feedback if you don't want to. This is going to go to Ease, which is the company that does our open enrollment portal here. It's not going to go to us. So it doesn't matter either way if you want to do that or not. You can submit the feedback or not. If you don't want to, then up here it'll say 100% complete. Please click on this finish button. And once you click on the finish button, it takes you there and you are done. So that's kind of Ease in a nutshell. Do anybody have any questions on that? And I can always go back in if need be. Nope. All right. All right. That's all I have. Does anybody have any questions like in general that you'd like me to answer, or you're welcome to always email me if something comes up after the fact. That happens all the time. So I'd be glad to help you out later on too.
So, couple of questions.
Yes.
One, are you okay with this going on YouTube for the team?
Sure. Yeah.
All right, cool. Yeah. Awesome. And second, while on here, I don't know if you care to give your email publicly, because at the end of this video, people will see it and they should be able to just email you directly. And we'll also put it on the description and we'll send it to the whole staff. But
perfect.
Yeah, I mean, no specific questions. We sat down and talked about this.
Yeah, exactly. Yeah. Perfect. Yeah, not a problem. I'd like to work with everybody individually. So any individual questions, or if you have any issues with Ease, let me know. I will probably direct you any questions with Ease as far as if something doesn't look right. I'll direct you to our account manager. Her name is Liz.Penning. And Liz is the Ease guru, so she will be able to help you, and she tweaks things on the back end to help out. So not a problem.
Awesome.
Great. All right. If there's no other questions, yeah. Have a great day, and thank you everybody for joining in.
Awesome. Thank you so much.
Yep.
Thank you so much.
Have a good rest of your
All
day.
right. Yeah. Good to see you. Take care.